Here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County. So if you or somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody.
Hello.
Well, it's not your turn yet.
Oh.
Okay. You got to be introduced. I want to introduce everyone to we're going to have a really great show today. We're going to disavow all those rumors that you hear about. Disavow. You never heard that?
Never heard that.
Doc, you heard about that. Disavow.
I did.
Yeah. All those rumors about hurting your shoulder and what to do, and I think for all the bodybuilders, for all the people that are going to go camping, go up and visit their kids in camp, this is going to be a show to get you ready for that. We have Freddy S., the man who takes care of all of us, to get you up to all those places that no one knows about, like New York. We got Carol, who's sitting there making sure that Dr. Pannozzo says the right thing. And we've got me, who doesn't really mean anything. And we got Dr. Pannozzo. How you doing, buddy?
I'm doing good.
Feeling good today?
Yes.
So anything new happened? Like we could talk to you every once in a while. Anything new happened? Patients that came in with something that they were suffering for all these years? Okay, Doc, so let's go to the question.
That was good. That was quick.
Our headache program is virtually 100% effective.
I mean, it's so amazing.
People should take advantage of it. That is state of the art.
So, as you could see...
Taking pills is not the way to treat headache. You got to get rid of the source, which is the ligament. And we know how to do that. They say, well, my neurologist doesn't do it. Well, he's not trained in musculoskeletal stuff, which is what we do.
Well,
So you're not going to be effective if you think your headache is something treatable. A headache is a symptom. You have to know what to treat. So I don't know, how many times do we have to say this before we get to that?
Well, you have to say it because understand one thing, people are turning in. I mean, right now, I have questions here from Washington, from California. People are listening to this show all over the world.
Wow. Okay.
First time listeners.
And
And I thought we were going to do patient denial today.
yes.
I spent 3-4 days in the hospital watching people deny that they're sick, that they have problems.
Oh, yeah.
Pain, afraid to come in. And people,
Older people, right, Freddie?
Yeah.
Mostly older people?
Well, people that even have called up, Doc, have waited a year to come see you. This is patient denial.
Yeah.
Well, you don't have to wait. Pain is not age related.
No.
Everybody has the same body all the time. Say, well, I'm getting old, I can't walk. That is not true. It is treatable. Everything is treatable.
Well, one thing, like, Freddie and I meet a lot of the people that that have gone to you. The one thing that always stands out in my brain is they'll mention they've gone to all these other physicians and they haven't been cured, and I say that means that your physician doesn't know how to cure you. It's like people that go to chiropractors, they go for all these different things, but they're never cured. And what I'm trying to understand, why do they still keep going?
The difference is when you go to those guys, chiropractors or orthopedists or PTs, they know how many treatments you can get paid for.
Yeah, right.
I don't. We'd say if you don't need to come in, don't come in. If you want to come in and get treated, if you have something to treat, you come in. Explain it to me what you want done, and we'll do it. But you're not under any schedule whatsoever. So if you're cured, don't come in.
Well, it was something funny.
In fact, we're trying to get rid of you all the time.
Freddie, you're next. I'm right after you.
You don't want them coming back.
We don't want you coming back because you crowd up my waiting room.
Yeah.
So we want to fix it, and then you're out of there. Yep. That's the way to go, people. don't go anywhere where you have to sign up for 22 visits. Don't do that.
800-889-0267 if you have a problem or you want a question answered by Dr. Pannozzo. Please feel free. We don't screen out calls. If you want to say something bad, you could call up too.
We have the best low back program there is. It is absolutely first class.
So, okay, talking about low back, there's this commercial for these two different types of hospitals that specialize in all kinds of back pains. One is where you have a little incision in your spine, and I don't know what they give you, but they give you something, and you walk out the next day.
Not true. No, I've seen those failures in my office.
Yeah, and that's why I want. Yeah,
and we take care of them. You can't read an MRI and know where your pain's from.
Mm-hmm.
You can't do it. There's nothing in the MRI that tells you this is what's hurting. You have to do that by taking a history and doing a clinical examination and a special film that we do, and then you can know where it is and why it is and what to do about it. And we call that the scenario. That's after your examinations, we show you what you have and why you have it, what's affecting it, and what to do about it before we do the treatment. So you have to say yes, do the treatment then.
So the treatment on low back takes about how long? Does it depend on how bad it is? I mean, it's not something you get on some low backs. You can't do it in one day, correct?
Oh well, it depends on how many sources of pain there is. If you have pain down one leg, one spot, that's one day.
Well,
that's cured right then and there.
Well, we had someone that came back twice because he had multiple pains in different parts, and you didn't want to give him all the shots in one day.
Yeah, some people have a rotten back because of years ago, and what they're feeling today.
Like golfers.
What they're feeling today is symptomatic of today, but you have to be able to analyze where it is, why it is, and what took place before. Mm-hmm. So you have to correct all that, and this is new thinking. Now, if you go to most places, they'll say, "Well, we need an MRI." That's when you know you're in shaky ground right there. MRIs don't tell you a heck of a lot.
Well, now the stuff when someone goes in for an MRI, it's a one-dimensional, correct?
Well, it's laying down,
right.
And it's read by someone who doesn't know you. Like I said, you need a history and a clinical exam before you get an X-ray. You know, people come to my office and they put a MRI in my nose. They say, "Here." I said, "I don't want to read that. We'll look at that last. We want to know what's wrong with you now." So you get a fresh look. You don't get the same look that the other guy did.
There's no scar tissue on the MRI,
The other guy is a failure. That's why you're here in my office.
So it doesn't see the scar tissue in MRI.
You don't see any ligament tissue at all. You see bone.
So that's the point that we're trying to. The reason why I could talk as a success story is because I've gone to you, and and Leah's gone to you. So anyone that endorses or talks about Dr. Pannozzo has actually gone for his service because they had pain. You've gone to him. Your son's gone to him. I've gone to him. My best friends have gone to him, and they all have the same thing. Here's what they go. I don't understand how this guy did this. I mean, I went to my doctor. He gave me physical therapy. I didn't listen to you and blah, blah, blah. And now the next day I'm playing basketball with my son, and I have a whole life.
This is true.
I know it's true.
I just talked to somebody Friday. After I took care of them, they played basketball. They played golf the next day.
Well, I saw the guy that did that.
And in order to play golf the next day, you have to have a good swing, right?
Right.
So that's what we do. We give you a good swing. And we have a special school with special instructors that can help your swing if you really want to play golf the right way. So we take your pain out, make your swing fluid, usable, and then you learn how to play the game.
Let me tell you, folks, as a golfer, that tee shot is so important. People don't realize how important that tee. You know, when you look down the green and you see 175 over the water. So if I hit it short, I'm in the water. So now I'm lying 3, and it's a par 4.
So hit it on the side and take a par 6. I mean, what are you gonna do?
Well, the best thing you do is that extra 10 or 15 yards, because if you have pain, you can't go all the way back.
Right.
Because you feel the pain, and if you feel pain, you can't follow through on that arc.
You know why I stopped playing golf?
Because you sucked.
I took a movie of myself.
Really?
And I said, I can't correct this myself. I'd have to go to Arizona
For Paul.
a month for Paul to fix me
Yeah.
up because structurally I couldn't
Yeah.
swing properly like these young guys do.
Well,
And so I said, well, and then I got so busy that I didn't have time to practice.
oh yeah.
So when you see 5-6 new people a day, you don't have time to go out and practice.
Well,
So I gave that up.
You
But
see,
we do treat golf
yeah.
injuries.
Oh, I mean, I brought in two golfers who had problems who are now playing very well. It's like my brother-in-law, who's a phenomenal golfer. I mean, he's like a 6 handicap, and the beauty of golf is two things: it's the drive and your short game. You want to be 90 yards away from the pin. When you're 90 yards out, if you can perfect that shot, and that shot isn't one that you go all the way back on, it's a 3/4 swing, and you have to get the ball up.
That's a good point you're making. The main swing, the full swing, is at the tee.
That's exactly right.
Yeah.
Exactly right. That's the key shot, and that's why you see a lot of these guys who are really great golfers. They're holding back because they have a little pain, but they don't want to tell anybody. And it's going to the left, or it's going to the right. They're not hitting it down the middle. And when you're out in the woods on your first tee shot, you know how many yards you got to make up just to get back on the green?
I can't find the ball. I just throw it in.
Oh yeah, well that's what a lot of people. Yeah, but
What do
you
you think?
can't.
I'm gonna go
That's
in
what
there.
I do. I'm not going to waste time.
I'm not gonna waste time go looking for a ball. I can't even walk. Why am I gonna waste time looking for that? I'm in pain, right? So why am I gonna go looking for a
The
ball?
worst thing in the world, because you don't know what's lying in there. I mean, first of all, I see a guy who has that retriever. I tell him this: the balls I buy are a Target. They're 25 cents a ball. If I was a 20, and they're using Pro V1s for $4 a ball, and I'll look at them and say, "You play just as badly as I do." Buy the 25-cent
But they
balls.
think that the good balls, the ball goes straight.
No, it really doesn't.
It
It's
doesn't.
What Dr. Pannozzo said is so correct. The guy that trains me to play golf, here's what he said. As the Indian said, it's not the archer, it's the bow and arrow. The only way you could fix your golf swing is to either A, change it because you have pain. This was the old thing, but now look what happened to one of the greatest golfers in the world, Tiger Woods.
No, he's not playing in the U.S. Open.
He's not playing in anything anymore because, first of all, I don't think he could qualify.
Another back surgery.
Yeah,
He
it's.
had another back surgery.
There's 3 of
Oh,
them.
I didn't hear about this one.
He had a third
Why
back
does he
surgery.
keep doing that? I
You know,
mean,
that's a good question.
You got to be smart, people. You got to be smart
That
about
is a
your
good
own
question,
body. When the surgeon doesn't work, don't do it again.
Not only he did it again, he did it again and again.
Yeah.
And then he had surgery, I think, on both his legs, Doc, or his
One
hip.
knee.
His hip.
I don't know, his
He's a
knee,
mess.
I don't know.
He's a mess.
Well, you know what he said? He says he can make more money on endorsements without getting hurt.
He is making a ton of money on
But
endorsements.
that's only going to last so long unless you start winning again.
Until somebody comes along that can be a champion in the golf.
You know what you just said is so true, and it was proven. You were right on the button. Under Armour, who has Jordan Spieth, who's one of the greatest golfers now, because he lost the Masters, their stock went down that day almost
Of course.
20%.
Of course, you want a champion that's going to keep winning.
Wow.
And what happened? He messed up on one hole, and that's all you need. You put a ball in the water on a par 3 and end up with a triple bogey. It's hard to make up a triple bogey.
Unfortunately, the golfers have gone home. So,
Or you mean in Florida?
yeah, the normal people are playing golf now, and they can't play in that heat. So it's limited yet. But still, this is a time to get that drive straightened out, get that swing up to normal.
Even if you don't play until the winter
We have
time.
a way of getting your speed up too. You want to have what speed you want? 105 miles an hour, 110. We can do that. You do that by exercise, but you
Yeah.
have to have a normal swing first, and then you add the exercise on top of that. So we
Because
can do all that for you.
I mean, he is so right on about this because every part of your body moves except your legs. So you're putting so much strain on your back and on your hips, and when you try to change your swing, you don't gain any yardage. You lose yardage trying to change your swing because if you can't go back far enough, you can't get that speed in.
You can't change the swing.
No.
That's what the PGA professionals want you to do. You can't do that. Don't change your swing. You work with what you have, get it to normal. Range of motion, get it to normal,
Yeah.
and then you have a great swing. Then the PGA guy could tell you how to play golf if he knows. No,
You could also help. I know a couple of my buddies were tennis players. You help them.
No.
Two of my buddies were basketball players, not professional, and you help them. You helped a Greek, which is a well-known name. You helped Leah, which is a well-known name. We did a commercial that, she was almost in tears talking about pain. She started talking about vertigo, because Leah now calls him up periodically, which is nice. And
She has vertigo?
Huh?
She has vertigo?
No, she has friends that had vertigo, and she calls up Doc, and Doc wanted to talk about vertigo because he treated Leah for something that was misdiagnosed by those
I'm
people.
glad you brought up vertigo because
Doc, that's what I do for a living.
We could take vertigo goes out one day. I'm not kidding.
No, it's unbelievable.
You know, we never kid on this show. I mean, we try to yuck it up a little bit, but still, the facts are
We
there.
never kid about health.
When we tell you that the migraine and vertigo goes in one day,
I saw it.
you got to believe it. It's true.
I saw it with
Try
two
it.
people.
What do you got to lose?
I saw it with a 40-year-old woman and a 70-year-old woman, both at the same time were in the office. 70-year-old woman said she has never in her life ever been pain-free of vertigo and of migraines until she saw him.
I met a guy in the doctor's office that went there the first time a couple of years ago and walked out. He did not have anything done.
Really?
Yeah. And then he came back and he says, man, what a mistake I made. He had a surgery. The surgery was botched. Famous word, Dr. Pannozzo likes.
That's Dr. Pannozzo's favorite word,
Yeah,
botched.
it was all messed up. It came in and he fixed it and he has to fix his hip. So I asked him, I said, why did you not do it? And and he says, I was in denial.
Yeah.
And that's a big thing that goes on with what Dr. Pannozzo does.
Yeah, unfortunately. Yeah.
The denial of knowing that there is actually somebody out there who's a medical doctor. I always want to let people know chiropractors are not medical.
And they're given other reasons.
Yeah, well, yeah.
They make up excuses.
Not me. It'll go away.
But here's
it's
the
not
difference.
serious.
When I tell you something in my office after I examine you and I say I could do this, this, and this, and you're going to lose your pain, you should do it. The other ones don't have that ability. They're going to put you on therapy. They're going to put you in surgery. They're going to put you in stuff. You got to be careful what advice you're listening to. You can't put your finger on it. They'll say, well, Pannozzo doesn't know what he's talking about. This is not,
I've been going to the other guy
you
for 10
can't-
years, never getting it right, but Pannozzo doesn't know what he's talking about.
Yeah.
That's the thing. It's
But
just
when
ridiculous.
somebody does that, you can't let that go because they're talking out of both sides of their mouth. They don't know what they're saying,
Well, let me ask you a question. If you had hip problems
Uh-huh.
and you went and got, now this is just open to three of us. If you had hip problems and you went to the doctor, you went for this physical therapy, because this actually happened to someone I know, and the surgery didn't work. And now you go back to the doctor and says, I'm going to give you somebody else that could help you with this.
Oh, I'm going to have to go in again.
For another surgery.
Right.
Okay? And I said to that person, let me ask you a stupid question. If you didn't have to go in for the surgery and someone was able to fix it, would you? He said, it's impossible. I said, okay.
You see, that's the thing right
That's
there.
the denial.
It's impossible.
It's
The denial.
impossible.
You see, what's at stake there? They think that the surgeon is the ultimate expert, and that is not true.
That could be the ultimate failure.
We're all doctors. We're all trained the same way.
Right.
They're trained in how to do a surgery. I'm trained in diagnosis and treatment.
And get rid
Musculoskeletal pain.
and not have to go in for
And
surgery.
you got relief right now.
Yeah.
Right now. I mean, 2 minutes, you have relief.
But think of it logically.
Somebody's listening to that and they're saying, how could you have relief in 2 minutes? My doctor says I have to have therapy for 6 months.
Well, hold it.
Because we know how to do it. That's why.
Not only relief, it's pain gone.
Yeah, it won't come back.
Yeah. Look at this, Doc. There's a new product I'm looking for. I want you to hear it too. It's a new concept. It's called the knee brace. And you put the knee brace on, and it's keyword, folks, relieves. RELIEVES, relieves pain, and it's covered by Medicare.
Did you spell that right?
Yeah, I before E except for a C.
Do
That's
you know?
right. That's the rule.
do you know, Les, that when you go to a hospital, they pump you first. They give you a bag of IV.
Oh yeah.
And then every medicine in the world is pumped into the body, because they may not know what's causing the pain. They want to relieve it in your head, and they're treating everything.
That's exactly
I mean,
right.
it's out of sight. The bill, I'm afraid to even look. The bill is going to be
Astronomical.
astronomical.
There's another product out there called Quell.
Oh,
You see that?
yes. With infrared heat, is that the one?
No, it's a pressure point
Yes.
on your knee.
I saw that one.
It's a fallout from acupuncture. That doesn't work either. That's not scientific, and neither is this.
You see, because
Don't do things like that. There is no easy way
There's
out.
no shortcuts.
You really have to know what you're doing.
like Freddy said was so true, it's that word denial.
Yeah.
Because people don't want to admit that they have pain.
Yeah.
So a doctor gives them a medicine. You're right. The first thing you do when they go to the hospital, boom, lie down, the bag comes in, and everything gets pumped in through the bag.
Yep.
You know, like I have claustrophobia, so I can't do an MRI for my pancreas. So they had to give me Ativan through the thing to calm me down, and my daughter was so smart. I wore an eye mask, so I couldn't see anything. So I'm singing in the MRI. The guy says, "Excuse me, could you shut up, please?" I said, "Yes, sir." And I was able to go for 45 minutes with contrast, without contrast. So I have no idea what that means.
I know, but what's your point of this?
My point is that people are going. Oh wait, there's a point to all this.
What is it,
I know what the
Freddie?
point is.
Hey Doc, let me ask you a question.
I know what he's talking about.
What am I? I am the talk show personality. You're the doctor.
I know
If you
what
wanna
he's
sit-
talking about.
Thank you. Explain to him, Doc. I want you
Well,
to
you know that in hospitals now, Doc,
explain to him what I'm talking about.
they put medicine in your body that you're paying for because they know psychologically you're a nervous wreck.
Thank you.
You're a nervous wreck.
Yes.
Sitting there, so they are trying
Yeah.
to soothe you. And then they put the medicine in.
Yeah.
I mean, bags and bags of medicine. I have never seen. I walked the floor last.
Well, that's the first thing you get is
Oh, my
open your veins.
Yeah, they want to open your vein in
and
case
they
some God forbid happens.
hang water up
the
there,
water,
salt water.
yeah, and it dilutes everything they put into you.
You know
but
what they
that's-
charge for that salt water?
Oh, forget about it. Like I
Let's
say, I
see.
didn't
One
look at the
bill
bill.
was 96,000. I think this one is 56.
It's
Wow.
just it's nuts.
Thank God I'm over 65. God bless you people and have those.
Well, the bottom line here is, back to denial. If I'm going to talk to people who have been in pain for at least a year, and you deny, and you're doing this because, number one, either you're afraid to admit there may be something wrong, you're going to a doctor who's giving you 4,000 pills
Yeah.
until they hit on the right one that's not going to cure you.
No.
It's just going to take the pain out of your head. That's the person I
That's
want.
the only thing that, Doc, am I right? The drugs just make you, it doesn't make the pain go away. It's like, Freddie, it makes you feel that the pain is away.
Yeah.
It's a mental thing.
I think we're the only ones that guarantee a result.
Oh,
Yeah,
yes.
I
absolutely.
mean, if I go through this whole thing with you, and I tell you how you're going to feel after I do this, and you say yes, then I'll do it, and I'm under the gun then. I have to produce, and I do.
Yeah.
And we record all these things, too. So,
Absolutely.
The beauty of what you do, which to me is the most amazing thing, is when you say it like you did with me, you found the source of my pain from my groin by just putting your thumb there. No, really. And you got
well,
rid of
what's
it.
the history? The
Yeah, I gave you
clinical
history.
exam.
I
The
sit there
thumb
for
was the
20
last
minutes.
thing.
How did I do this? Blah.
He missed the most important stuff.
The cause.
History.
History.
How did you get it?
I think I flunked history, Doc. You know what I want to do, Doc? We got some great questions,
Okay.
and I don't want to let these people
Go ahead.
not know that we spoke about them. Okay. Doc, get ready. Unless you want to read that first. It's up to you.
All right, Waging
Okay.
a War on Pain. This
Okay,
is
that's good.
a magazine. Moving military medicine in a new holistic direction. Don't do it. This is going from bad to worse. First of all, they push narcotics for, for back pain. And I keep telling people, don't go over there and expect to get well. They're going to give you narcotics because that's all they know. And now they want to do holistic, which is, I mean,
I don't even understand what that
what
is.
is this?
I don't know what holistic is.
I have no idea.
I've heard the word.
Well, holistic is herbal. It has to do with taking care of pain without having medical procedure done.
Yeah.
And the problem with having holistic is that holistic is a state of mind.
The Japanese culture.
Yeah, I mean, people see a Chinese acupuncturist and they go in there and he twerks you and pins you and does whatever he has to do. You walk out of there thinking, okay,
I'm better now.
I'm better now. So you go out to the supermarket to get food, and all of a sudden, like what happened to Sweet Lou, you cured him. He went to wherever he went to. I'm not even gonna say. And I see him the next hour, and he can't move, and he's crying. I said, "What's the matter?"
Yeah, he
I
went to the
I went to the
chiropractor, that's why.
chiropractor, and now I'm hurt. I gotta see Pannozzo again. I mean, that's the problem. with holistic medicine.
Holistic has no science to it.
No, they've proven this.
You
Magnetic,
still need what?
a cause and an effect.
Source. You need a source
And the
of
ability
treatment.
to stretch. If you can't stretch, you have a problem.
You have a problem.
Well, you know something. If you want to go to yoga, chair yoga, stretch yoga, whatever, if you want to do all that, go do it. But the bottom line here, if you want your pain relieved, come see Dr. Pannozzo. Let him relieve it. He'll give you more movement. He'll give you the opportunity
Give you the
to
movement
do.
back.
Yeah, he'll give you the opportunity to do yoga.
We have some really famous yoga instructors that come in my office.
Yeah, I saw a couple of those, Doctor. Pretty hot.
And they have to perform because they're teachers.
Well, they're gonna get down into the lotus, the kissing cow, the tushy pose. I mean, all that stuff, right?
We got to pull everything out of the hat and fix them.
Did he say the kissing cow?
Kissing cow, right? Hey, Joey, how you doing? I'm glad you're watching us on TV. And Joey from New York City wants to know. He said, I've watched a number of shows and wanted to ask. Inflammation seems to be the main culprit of pain in the body. My question, Doc, is there a disease that causes that inflammation? I have a bad hip that the pain comes from inflammation. Then does that mean I don't have a diseased hip? I've been told by my doctor it's hip degeneration. So does that mean all that's wrong is inflammation, or do I have degeneration of the hip?
That's an interesting question,
Yeah.
Doc. He wants to know what
It's
causes
from New York,
the
that's why.
inflammation.
There is no inflammation in the whole body. I mean, in the musculoskeletal business that I'm involved in,
Okay.
every injury causes inflammation and causes scar tissue after that. So three things, boom, 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 and then you have a range of motion loss,
Right.
because it hurts so bad. That inflammation is treatable.
So
you
it's
have
the injury and then the inflammation.
it's always an injury,
Injury first.
There
What
is no
about the-
inflammation unless you get an injury first.
What about degenerate hip?
There is no such thing. The hip pain is a cause for the hip to repair itself. So it's a positive effect, not a negative effect.
Wow.
So
Yeah.
you actually
So-
need the inflammation.
And
as the
it's
body
all
healing itself?
it's all ligament. The hip itself doesn't have any pain
I
fibers.
learn every day something new.
The hip itself,
Yeah, me too.
like every joint, does not have any pain fibers in it, and that works out because the design is for you to bear weight, right? Now,
Right.
if you're hurting every time you bear weight, would you walk? No, you wouldn't. So the design, I mean, if you go back to that, is for the ligament structure to have the pain, not inside the joint itself. So when you have your knee replaced, wrong,
Or your hip replaced.
or your hip, it's only about 3 inches of ligament that is painful, and you're throwing away the whole thing just for that.
You know
Don't
something?
do it. It's not right. Don't do it.
You're right. I learn something every day.
Yeah,
so,
it's amazing.
So
Every
Dr.
time
Pannozzo's
every
saying,
show for 2 years, it's something different. It's
so these
amazing.
hip surgeries, Doc, are really, we shouldn't have them. I mean, I hate to say that.
You shouldn't have them because you could die under anesthesia. You could have a heart attack. There's all kinds of things really not to do it. You can have an infection, but that's rare. They have special rooms that they do these things in, so you don't get infections.
Yeah, why do they keep it so cold in those rooms?
Infection.
Because the doctor has all his clothes on.
You know, I think that the best advice we could give this.
Also, they want to cut your blood pressure down and keep you calm, so that
Oh, okay.
the anesthesiologist keeps you going, but at a reduced rate of metabolism until they get done. After they sew you up, then they wake you up.
96,000 and rising of those types of surgeries should never have been done.
Well, I don't think any hip should be operated, and no knee should be operated either, and especially ankles. Do not ever operate your ankle, ever, 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 or wrists. And the reason is you need mobility, and scar tissue, by its very nature, decreases mobility. And
According
so, what have you gained there? Absolutely nothing.
I
Don't
got
do
it right
it.
here, Doc.
So when you have that pressure in the foot or in the ankle,
That's
or
all
the wrist,
treatable stuff because it's all ligaments.
it's ligaments that are inflamed and there's
That's it.
inflammation, and it's because the body's trying to heal itself.
That's right. So it's an
Holy
injury
smokes.
there. So
You hear this?
what we do
Yeah.
is we just inject all that, and all that pain goes away. You'd be surprised what kind of work we do when you see these things.
WebMD.
I mean, we don't film all this stuff.
Well, you can't. I mean,
we should,
well,
because you can't believe how fast they recover.
if people don't believe WebMD, 3 out of 5 patients that have surgery of the knee or of the hips are happy. Only 3 out of 5 are happy. I'm sorry.
3 out of 5. What percent is that?
I'm just giving you the way they wrote. I don't want to add anything into
It's
something
like
that's not real.
60%.
Okay.
So you should have 85% cure rate or
And
better.
infections, blood clots, complications of anesthesia, discomfort, too much medications, and have to get it done again.
Right.
Okay, that's what
Question.
Another question, Doc? Okay.
Yep.
No problem.
Tell Joey is that Joey was the guy's name? Tell him to come down and see Dr. Pannozzo. That's the best advice he can get.
Joey, 561-381-5800. Dr. Pannozzo will be more than happy to talk to you on the phone since he answers his own calls.
That was a good question. Though.
Yeah, well, New
Learned
York.
something today.
You see how the confused people get from their doctors.
Absolutely. That's why we had to
And the
keep
stuff
this.
they read. Don't read anything. Ask the expert.
Felicia from New York City, Doctor writes, I've watched many of your shows and was amazed that you can actually remove migraine headaches and noticed that the injury to the area is what the migraine is all about. I wanted to know if no injury has ever been recorded in my neck area, and my parents agree never had an injury like that since I was a child. But I do suffer from migraines. Could something else cause me to have these migraines, or perhaps I hurt myself while moving around? The reason I ask, could something else be causing
How old
my...
is she?
Oh, she doesn't give an age.
Doesn't give an age.
Give an age.
But this is a good question because
Yeah.
she doesn't realize that maybe she has injured herself, Doc.
Well, she's mentioning migraine, but see, to me, that's a specific thing.
Right.
She's not using it in that context. So something happened to her, and it may not even be a migraine. Maybe a bad neck. See, so.
Do you think the doctors are classifying as a migraine just to give her pills and moving her on?
Yeah, I don't think that's an in-depth diagnosis because they don't know where it's from. I did the research on it. That's why I know.
You actually explain what you did with that research. Didn't you take a brain with another doctor and you looked at it? To
Yeah,
see?
we went down to medical school and we dissected the area where I thought it was from, and we found out it's very safe there, and we start treating that. And my son was treating it also. And that's my feedback, see.
No, it's good
So
because
he does things and he'll say it works or it doesn't work, and then we'll
we know younger generation.
redo it,
Yeah, the younger
and
generation.
then we try something else and see if that works, and then we get it. So migraine is 100% effective. A real migraine, not just a headache.
Well, now the NFL is finding out that that what you had said a long time ago. It's not so much from the head, because the head is they were explaining what you explained.
What,
that the brain
concussions
is
you're talking about?
that it's a neck injury that causes all that. They had the thing with O.J. Simpson. They had a 2-hour show, and he was hit so many times as a running back when he holds a world record right now, over 2,000, over how many? It was 220,000 in a year. No, I'm sorry, I can't remember it. 2,020 yards in 1 year. That what's his name? Jim Brown held.
Right.
Now he holds it, and they're finding out now when someone passes away, they're finding out that the injury to the brain was neck related. And you've been
It's all
saying
neck related.
and you've been saying that ever since you did the show.
Yeah, somebody was talking the other day, and they said, well, if you play football, you're going to get what Muhammad Ali had. And I said, well, my brother never played football, and he has that.
Neither did Michael J. Fox.
So, I mean,
Yeah, played football, Michael
that
J.
doesn't
Fox.
follow. You have to be really scientific about this stuff.
Where do you
and
think?
which we
Where
are.
does that come? I mean, would you know how do they get that kind of disease, Parkinson's disease? I mean,
Parkinson's, it's there's a bunch of cells that control the motion, and it stops producing a hormone or
yeah.
a chemical, and that's so.
I was
then
just testing you. That's exactly
you see
right.
the result
Yeah.
of not having it, and so what they try to give it to you, but it doesn't work.
No, Michael J. Fox actually went in for that operation. and
Well,
it
I
didn't
don't
work.
think he even had it. I mean, I think there was a misnomer,
Okay.
but that's my opinion.
Hey, look, everyone.
Well, you know that the NBA championships, the Warriors and the Cavs, which is about to come to a conclusion, and the basketball player Love got hit with a
Yeah.
elbow on the head,
I saw that. Yeah.
and he felt wobbly. So they took him in, and he came back and played, and they took him back in. The NBA concussion protocol. Have you seen it? They ask. The first part is they ask you questions. The second part, you have to ride a stationary bike for 15 minutes or 10 minutes or something. And the third part, you have to be able to walk a straight line. If you can't do any one of those parts, you're out of the game, and he couldn't do it. And they took him out of the game.
Don't they do that when you're drunk?
It sounds like it. But he came back 3 days later because they needed him. They were down, and he played 3 days later or 2 days later. So all of a sudden the concussion disappeared. I don't get it.
Concussion, I don't think is a good it's a good description of what goes on. I think most of it's from the neck.
Do you, Matt? Could you be amazed at how much money these teams would make if they just had the opportunity to meet this guy?
Well, David
What
Wright.
guy?
You, Dr.
Oh,
Pannozzo.
me.
David Wright is in Port St. Lucie, and he's on the DL. Okay, I don't know about the stress fraction for Duda, but the Mets need these two players. I'm sorry to tell you, the Mets season's going in the
Oh,
toilet.
yeah.
And they think that by getting them back, they're gonna make do whatever. We should go up there and talk to these guys, especially Wright. With the herniated disc.
Do you
and
know
the
anybody
bulging
there
disc.
that we could go up? I don't know
I'm
anyone
working
there.
on it.
Can't talk to the surgeon. His control. He has a contract, and you can't break into that.
All I want to do is talk
you-
to him. I don't want to treat him yet.
If you don't do what the surgeon tells you to do, they can cancel your contract.
That's right.
Well, I'm gonna tell you something. I
You
think-
can't get disability payments if you
That's the one.
don't do what
Yeah.
they tell
Well, I
you
think
to.
David's playing days are over.
Yeah, what Dr.
Now,
Pannozzo said.
now after they retire, they come to see me and
Yeah.
I fix them.
Yeah.
I mean,
They want to be
Right.
fixed now so they can make millions.
like
of dollars.
Cheevers. We're talking about Cheevers there. Do you know on second visit he's already saved his knee?
Unbelievable.
Yeah. He was in there and he was telling us how great he was feeling, and he's coming back in 4 days. I mean, it's just, if you know how to do it, you can treat this stuff, and it's real. What we're talking about is real stuff. Go ahead.
Okay, we got some from Atlanta. Sammy from Atlanta writes, my eldest son suffers from a bad shoulder. The doctors say that I'm sorry, I can't read. The doctors say they want to operate his shoulder because they say he suffers from arthritis and the bones have become brittle. He's been in a cast for 4 months and has not healed since. Can you explain if perhaps what you do to heal his pain? He cannot raise his arm over his head and was lifting heavy boxes at work when the injury occurred. He's mounted tons of bills and still has not come close to feeling better. Can you help him?
Well, absolutely.
The answer on that one is
How
definitely
old
yes.
is he?
Said his eldest son, but doesn't say how old.
There
Evidently
is no
he's-
such thing as brittle bones. What the hell does that mean?
What's a brittle bone?
I don't know.
These orthopedic surgeons will tell you anything. I mean, I just can't believe it. I don't know where they got that. Brittle bones, it does not happen. That's not a medical term.
Yeah, I never heard of brittle
No.
bones.
No, his problem is treatable in 1 day.
Amazing.
We just
Amazing.
had a 17-year-old in a pitcher, and he couldn't lift his arm front ways like this. Couldn't do that, and inside of 2 minutes, he was up like that. His father dropped his jaw. I said, wow.
But it's so freaking amazing. I mean,
Because the kid had the pain for almost a year.
here's what I'm telling everyone out there. You don't have to see Dr. Pannozzo, but why don't you come in? Don't even put your name on the little on his sheet. Come in, watch a patient go in, and watch them come out. And if that doesn't make you believe,
Well, you can just ask him how are you doing under this treatment, and they'll tell you that.
I mean, before you and I did this show, I actually watched a guy who told me when he first met you, he was in one of those scooter things. And when I saw him that day, he was only walking with a cane. I can't remember the guy's name. This is going back before he even did the shows. And he told me every single doctor he has went to was never able to get rid of the pain and never come back again. That lady we met at the seminar who came in to see you, and she was like crying. She
Yep.
couldn't believe that she has no more pain anymore.
Yeah, it took us, I think it was 4 visits.
Yeah, because she was in pain everywhere.
Fix that, yeah.
Yeah, she was, poor woman. Okay, let's go to Erica from Washington. Hey, Washington, Freddy, very good. I found your show on your website and saw a female who was treated for scoliosis. I want to know how she's doing, and can anyone of any age be treated for this ailment? I have never seen your show, but will be listening or watching this week, and I suffer from scoliosis. Well, we can't show every single video, but we have as many as you want to see.
Yeah, you can go to Pannozzo.tv and see.
Oh, you
the
can?
scoliosis.
Go to Pannozzo, PANNOZZO.TV, and you could see some of the patients. There were young ones. There were elderly ones. Am I correct, Freddie?
Yeah, we also sent her a couple of clips
Okay.
of shows and stuff.
There's another YouTube, Dr. Pannozzo, MD. You can go to that one. You'll see a bunch of different ones.
Okay. Good. All right. Joey, God, look at this. California. My God, you are world renowned. Joey from California writes, I watch a couple of the shows you guys do, and we really are surprised to find that you can remove pain from your body by finding the source and using your technique to remove the inflammation in that area. How long have you been doing this? And I have two questions. Does the pain return once the area is treated, and how long does it take for you to produce the, and how long does it take for the procedure to heal the affected area? So here's a new listener, Doc, who wants to know all that stuff. He wants to know, how long have you been doing this? 53 or 54 years?
Something like that.
Yeah, 54 years. Okay, the second one is, does the pain return once the area is treated?
No.
Okay, so we answered it. He's been doing it for 53 years, graduate of Ohio State University. And I have never seen a patient come back yet with the same pain he went into it. That's the difference.
Well, sometimes people will call me and they'll say,
This could be Joey.
and they'll say, oh, my pain came back. No, it does not come back.
Might come back somewhere else. Who's that? Is that Joey?
Joey, I don't know.
Okay.
You know, the
missed call.
funny thing is that Dr. Pannozzo cured somebody who worked here at the station.
Yes. Well,
And-
two people, Jimmy
Yeah, but the young girl.
and Helene.
And she has pain from a different area, and the doc explained because we didn't know what was going
No.
on.
Well, Carol just said she had pain. The pain that she came with, he got rid of.
Right.
And now she has pain in another area that she wants to come
Right,
back
so
and
that's-
see him.
She had
sometimes-
that for years. She
Yeah,
was taking
years.
a lot of medication.
I saw
for
the
a year.
medication was unbelievable.
And that really made me feel bad, that anybody could do that to this young girl. I mean, she's really a nice young girl.
Yeah, she came in here, she was crying. And says,
Well, she was crying in the office.
yeah, but she's in a
when
lot
that
of
pain
pain.
left in the office. I mean, while she was there,
And they told her there was a migraine, doc.
it was a migraine.
That's
Yeah.
what they told her.
You know, what really bothers me is don't say you can't cure anything if you and feed you with all the drugs. I mean, this man doesn't. He has a bit. That could be Joey too.
It's from Jupiter.
Jupiter. The
I'll call
planet.
you back.
Yeah, call you
Jupiter.
back.
Dr.
Jupiter.
Pannozzo will call you back. He promises. Right
And
now,
he
we're
answers
doing
his calls. That's why the phone's ringing.
Yeah, that's something too. How many doctors you know do two things: answer their own phones, and guarantee the service.
Well, Paul does. Me and Paul.
Well, that's two people.
we're the only ones.
This is a big planet, Doc. Next one.
big
Oh,
planet.
we got
You
one
know
from.
why we feel close to you?
Yes.
If you have a pain, you need to talk to the expert, not the secretary, not a therapist, not
Right. The
anybody
radiologist.
else. You want to talk to the guy who's going to treat you.
You know,
And
doc,
that's me.
you know something that hits home
Mm.
because somebody we know went to the hospital. She doesn't want me to name her name.
That's okay.
And the stuff, the X-rays or the MRI, whatever they were taking, they fed the information that they saw to the doctors, and it was all over the place. It could be, because one person was reading it and giving their. This is nuts, man.
Their interpretation.
Oh my
right?
goodness gracious! So you have to take 700 different medicines to see if they can hit the right one.
Not good.
Boy, are we busy today?
That's okay.
Okay, go ahead.
Okay, next one we have doctors from Larry, and Larry is in Miami. He says, I've seen many of your shows and want to know if you had an offer your procedures at college or medical schools, and so more people can find relief without surgery. Does your treatment have a place in the medical books explaining how and what you do? By the medical community. Wow.
Well, he sounds like he's in the medical community.
All right, that sounds, yeah.
All they have to do is ask. I could go and lecture about what we do to anybody.
Yeah.
And I don't need it. I don't need preparation. You want me to talk about a headache? I could do that for an hour.
So
About
anybody-
scoliosis, I could do that.
And
Low back pain, I could tell you the ins and outs, how to get results, but they have to ask for it, and they're not asking.
anybody that wants Dr. Pannozzo to do a seminar, just give us a call.
You give us a call. He'll come anytime that's where he's not busy, and we'll be more than happy for Dr. Pannozzo to show you everything.
These medical schools that you're talking about there, all they have to do, they have lunch. Ask me to come to lunch and talk. I would do that.
Well, it depends what they're serving. Okay.
Not very good fare, but
No,
that's,
I
hey,
know.
I remember when I was a resident, the
Oh, yeah.
food wasn't all that good, but you ate it anyway.
Even when you went to the doctor's special cafeteria, it was still bad, I know. Hamburgers aren't supposed to be green, are they, Freddie? Yeah. Only on
Yes.
St. Patrick's Day, okay. Logan from Atlanta writes, I suffer from flat feet. I have pain that goes from the arch to the knee. I tried everything to remove the pain and wanted to ask you if there was something I could take to help me. If not, then please say the number to your office. I will make
there you go.
arrangements to go down and see you. Okay, first, you answer him.
Where are they from?
Atlanta.
Atlanta.
90 minutes. Not even 90 minutes.
There is
actually.
nothing you could take.
Okay. First of all, I'm going to answer that. 561-381-5800. You tell Dr. Pannozzo exactly where your pain is and explain to him. He'll diagnose it over the phone and tell you to come on down.
I wouldn't say that.
You wouldn't say that?
I can't diagnose over the phone.
No, I shouldn't use the word diagnose. Tell you what you think the problem
The
is.
impression.
Yeah, an impression
could
of what
be.
it
Yes,
is.
I could do that.
Right, so like if you have, okay, so let me give the numbers 561-381-5800. And Spirit Airlines are running deals from Atlanta to
And give
Fort
his
Worth.
address.
16244 Military Trail.
South Military
South
Trail,
Military.
Delray Beach.
Delray Beach.
Suite
Very
740.
Yeah.
And when you come down, we'll send you to for breakfast at
Puppies.
Poppy's.
Oh, now you're dealing with poppies? I thought it
No,
was the
no,
other
we're not
place.
dealing with anyone. We just eat there all the time. We don't even get a discount. Oh, yeah, once in a while the owner will give me a rug over for free.
Oh, regular.
Yeah, we don't deal with it. It's just that the food
You
is...
can't even
There's,
read that.
Francesca's around the corner.
Yeah, it's right across. Yeah, right. I mean, you can eat there. You can take a plane
That's
back.
our neighborhood. That's where we
Yeah.
go.
In other words, you can come down in the morning, get cured, have lunch at Poppy's, and guess what? Be home the same day with no more pain. Who could tell you that?
Nobody. You can take
Anybody.
a flight back that evening if everything goes well. You can take a flight back home. You're done.
Yeah. I mean, who else could do this?
Nobody.
Nobody. With a guarantee. You can't even get a guarantee on your car after 100,000 miles. Oh, he is now called the Tarzan of pain. Now what we got to do is find out where Jane went. Okay. Nancy from Boca Raton writes, my
Jane's
sister...
waiting for me at our hut.
Okay, good. Make sure it's not cheetah. Okay, Nancy from Boca Raton writes, my sister went to see you with bad hips and tells me that you don't give medication. Yes. I just wanted to ask what the difference between you giving shots and medication. Oh, it's a great question. In all the years that you have done this, you have never once offered medication. How does one keep the pain away without medication?
Well, you cure the pain, you cure the source, and it doesn't come back.
Okay, so why is... let me ask you...
It's not treated the way medicine is treated.
But what we're referring to is we don't give you prescriptions that you can take outside the office and by mouth.
Right.
Every medication we give is a steroid. It's anti-inflammatory.
That goes to the source
It has
of the
to be-
pain.
It has to go into the source because there's not that much there. I mean, we use them, less than a teaspoon. I mean, it's a very small amount.
So Nancy...
But it has to be in the right
Yeah,
spot.
Nancy, basically what we're saying, so you understand this, and I'm not saying you're not an intelligent person, is he doesn't give medication because medication doesn't work. He gives you the cure. What the cure means is take all those bottles and dump them down the toilet bowl because evidently it's not working for you.
That's right.
All right?
We treat the source.
So, Nancy, if you want to call Dr. Pannozzo, he's probably right around the corner for you. It's 561-381-5800. You'll be amazed. He's very patient. He understands what pain is, and he'll get rid of you. I don't
Me?
mean we'll get rid of the pain.
I'm not patient. What are you talking
Yeah, sometimes you're nice. You just want to cure.
about? Sometimes.
Well, let's face it, Doc, if you do that thing with your hand anymore, I'm not going to read the questions. On
Next
spite.
question. Next question.
Travis from New York. I love when I get those New York questions. I have a rotator cuff injury that's going to keep me out of work for 6 weeks. I can lift my arm and extension is almost impossible. The doctors informed me that I don't heal. I will need surgery to repair the injured area. Are they talking about repairing a tendon or something else for the rotator cuff injury? Can you provide me with the information that I won't have to have the surgery and be able to get back to work immediately?
Yeah, if you come in.
Yeah.
So rotator cuff injuries can be...
Well, that's a euphemism. Is that the right term?
Yes.
That's the-
Saying something nice about something not so nice.
You don't know what they're talking about when they talk like that.
Right.
Usually it isn't. Abduction, in other words, bringing your elbow sideways, that's rotator cuff. And if you can do that, you don't have a rotator cuff.
Well, isn't that the thing that every tennis player says? I have a rotator cuff injury.
Well, that's because they're told that by their trainers and their therapists and their surgeons. They're told that.
So let me
But it rarely happens. In fact, hardly ever happens.
So, Travis, let me tell you this from personal experience. I brought in 3 very good friends of mine, and they were playing tennis the next day
Yep.
with the so-called rotator cuff injury. If you want to get cured, folks, let me just say this. The only thing I can guarantee you is that A, you will get cured, and B, you will be able to have your life back again.
We'll explain to you if you come in for a shoulder. We'll explain to you with a chart and where your problem actually is from the
Yeah,
examination.
you had you got a lot of extensive questions at US. Because I had to go through that. You
Yeah.
find out everything.
And then we show you on the fluoroscope where
Right.
the actual scar tissue is that's causing this pain, and then we treat it directly.
Isn't it amazing?
Yeah, it's amazing because your arm goes straight up, right? 2 minutes. I mean, you say, what happened? Well, you got to treat the source. I mean, it's that good. And we're not messing around with your brain either. This
No.
is true stuff that we're talking about here.
What's the worst thing could happen? He doesn't fix you, which I've
I
never
mean,
seen. That.
elbows, too. We saw a kid with elbow. We saw high school kids, 2 of them did last week. One had a shoulder, and the arm went straight up. His father was, he couldn't believe it. But that's a cure. That's not coming back. And then a kid with an elbow, it wasn't the elbow at all. It was a muscle.
Mm-hmm.
So you have to distinguish what you're treating. If you don't, then you're going to miss it.
See, what you said is so phenomenal. Leah, anyone that listens to WZZR, which I know everybody does because it's a great radio station.
Well, we're on ZZR.
Yeah, we are on ZZR, and I mean we're on ZZR now. But what I meant by saying that to us is Leah, which is probably #1 show out there, who came in with a ankle problem, and this to me, with everything you've done, amazed me more than anything. When you diagnosed it as not an ankle problem, just by her walking back and forth.
Yeah, it was.
She looked pretty good walking back and forth, did she, Doug?
Yeah, she's got a beautiful gait.
Yeah.
Beautiful.
But what I'm trying to say to everyone, if you're going to go again, I'm not negating anything any doctor says, but when you go to a podiatrist, he's going to work on the ankle because he doesn't know. Am I saying right? Referred pain. He doesn't know where the pain actually is. But you saved a person from getting cortisone shots in the ankle, a boot, and she is a very active. I mean, she rollerblades, she skates, she does everything. You actually helped her keep her life the way it was in one day.
Right.
Came in one day, the next day she was out with the kids.
What we did with her is actually no one in the world does that.
No.
I created that treatment myself.
Which is amazing.
And it's definable, reproducible, and is a science. And so if you have that kind of a problem, low back pain or ankle, anything in the leg, see us first before you go screwing around. We'll give you the right answer. Then you don't have to do anything either.
No, I mean, if you don't want to use them, you don't want to get the shot, that's up to you. But guess what? We were there when that woman wouldn't get the shot, and finally got the shot. You know, the woman, I don't want, a robust woman. Is that a good way to say it? And her husband said, "Get the shot, Sally." That's not her real name. And when she finally got the shot, she said, "Oh my gosh." And here's the beauty of it. If you cannot leave his office, if you try to reproduce the pain you came in with, that to me is amazing, Freddie. He got it to a science where you cannot leave that office if you could reproduce the pain. And I watched people trying to move to get the pain. They couldn't get the pain back.
Yep.
He did it to me.
There was a patient that he had. And she says,
that's amazing.
She says to him, I'm sitting in the kitchen listening, but I don't feel any better. Meanwhile, when she walked in, she was in a stroller. When she was walking out, she was walking. And he's looking at her like, "You don't feel nothing?" "No, I feel the same, doctor. It didn't work." Meanwhile, she's walking.
There was another guy that was in who couldn't go past his waist, and he came. He said, "No, doc, I don't think it did anything." He was able to touch his toes.
Right.
He couldn't even bend his back, but now he's touching his toes. He said, "Well, I got just a little pain here." And I'm saying to myself, you walked in, you couldn't even walk, you couldn't even bend your neck down, and now you're touching your toes?
You know, all of this got to be filmed and shown on television because people don't believe this. I mean,
I'm going to tell you.
I know they don't. There's a lot of skeptics out there.
You know, there's a lot of skeptics. I mean, we know people that waited a year to come see you, and they look at you and said, I'm an idiot,
Yeah,
not
well,
me. They're an idiot that they waited this long, because they're being filled with information that is
not true.
correct.
It is absolutely not true.
And if you don't believe me, you could go to WebMD, go to JAMA, read all the things. Everything I say to you comes from other sources. Now, if they're lying, that's not my fault. I'm just reading it.
Well, we'll tell you, based on the anatomy, we'll show you the anatomy book, we'll show you a chart, exactly where it is, and the x-ray will show you why it is. It's a special film we do. I had a patent on it, by the way.
Which is amazing right there.
Yeah, and it's that film is a weight-bearing film. I call it a weight-bearing film because it shows me how you're bearing weight, where your how your bone structure is related, how you're bearing weight, and then you go back and say, well, this is why you're doing that, and then we fix that, and then we fix that.
So before we leave, folks, I want to leave you with this one thing. When you go to the other doctor called a surgeon, and after he fixes your hip, I want you to bend down and touch your toes and see if you can, okay? For all you people that play tennis and have rotator cuff injuries, I want to see if you can play tennis the next day after the doctor gives you surgery on something that should have been done. And before we go, I'm going to leave you with this thought. Anyone that has shoulder pain, according to the Men's Health magazine, could take anywhere from 3 to 6 weeks to cure. So all you bodybuilders who have trouble with your shoulders, Doc, how long could you get rid of a shoulder pain right up here in this area?
Well, depending if it's from the neck or not.
Okay.
We have to know where it's from, first of all,
Okay.
and then it's 1 day.
One day.
1 day.
And he could be in the gym.
Yeah.
How about a groin injury, Doc?
Same thing.
Okay. Let me talk from experience, folks. I'm going to leave you with this thought. Was in on Monday with the groin injury. Was doing leg curls and leg weights with the shot. And what Dr. Pannozzo always said to all my bodybuilding friends who now believe what I told them, 8 sets, not
By the way, a lot
10.
of those guys that you see in the gym are there because they're not able to perform at home. Mm-hmm. We'll make that possible for you.
Oh, then I'm coming for another shot. I told you the reason why I take Viagra, Doc, so I don't fall out of bed. I just want everyone to know that if you enjoyed the show or you didn't enjoy the show, you can call Dr. Pannozzo up at 561-381-5800. Give him a chance to answer the 4 calls we got already.
Yep.
He's in one of the most beautiful areas in the world, and you people that live in Atlanta, you can have a great day. You know what? Pain is not fun. When you can't get out of bed and go to the bathroom because your groin is killing you, it ain't fun, Doc. I don't want somebody readjusting my leg and readjusting my hip. Doc, say goodbye.
We make it fun at the office.
Yes,
so
we
you'll
do.
be surprised how we do that. But anyway, goodbye.
561-381-5800. Carol, thank you so
Have a
much for
good
helping
week.
us. Freddie S., thank you for always. Gio and the rest of the crew. God bless our troops. Let everyone have a great, great, great weekend. Thank you.
It's a Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.